Welcome, Master of Public Health students. Look, I know exactly why you're tuning in. The comprehensive exam is looming, the anxiety is totally real, and honestly, the sheer volume of material you're expected to know is downright intimidating, right? But take a deep breath. In this explainer, we're going to directly develop the precise answers to those comprehensive exam questions for your MPH. Consider this your tactical mission playbook. We're going to decode the frameworks, break down the case studies, and give you exactly what you need to confidently conquer this exam.
Okay, let's just dive right into our agenda. We'll start with a quick overview of the MPH exam, then cover the rules of the game and evaluation, break down the proceed model, build out an action plan for childhood malnutrition, and finally, wrap things up with some next steps. Section 1. The MPH Comprehensive Exam.
So what does this beast actually look like? You're looking at a 2-day event, 4 hours each day. And yes, it is entirely closed book. That means no laptops, no cell phones, 0 notes. Part 1 covers your core courses, where you'll choose 2 out of 3 questions to answer. Part 2 covers your emphasis courses, again, choosing 2 of 3 questions. The biggest advice here, eat a good breakfast and hydrate. Seriously, treat this thing like a marathon, not a sprint. Pace yourself, because your endurance matters just as much as your knowledge.
Moving right along to Section 2, Rules of the Game and Evaluation.
All right, to actually pass this exam, you need a B average grade or better overall. But here's the critical catch you've got to remember. You cannot have an average grade lower than a C on any single question. If you drop below a C on just one question, even if you maintain a B overall, you're facing an oral or written follow-up exam. Drop below a C on more than one, and that's a no pass, which means you're retaking the whole thing months later. Consistency across all your answers is absolutely crucial for passing the first time around. Section 3, Analyzing the Proceed model. Let's get into the actual questions. Let's immerse ourselves in the first prompt. Imagine this. You've just been hired by an international NGO as the director of a 3-year project to combat non-communicable diseases in a small Asian province. Your assignment? You need to find out which non-communicable disease causes the most mortality. Assume what that disease is, and then design an intervention and evaluation plan using the proceed model. Now, what's really interesting about this core tool is its definition. The proceed model, which actually originated back in 1974, is the ultimate cost-efficient framework for community assessment. To secure full points on this exam question, you must spell out exactly what the acronym stands for and clearly define its phases. Visually, it kind of helps to mentally split the framework right down the middle. Proceed is all about diagnosing the problem. Phases 1 through 4 guide you through identifying the ultimate result, setting your priorities, determining predisposing factors, and analyzing policies. Proceed, on the other hand, is your action and evaluation plan. Phases 5 through 8 cover implementation, process evaluation, impact evaluation, and outcome evaluation. Diagnosis first, execution second. Since the prompt asks us to make an assumption based on our assessment, let's assume our data collection, the surveys, focus groups, hospital data, reveals that coronary heart disease, or CHD, is the absolute highest mortality driver in this province. Why? Well, because we identified specific behavioral and environmental factors. Highly sedentary lifestyles, diets super high in saturated fats and sodium, and a massive rate of smokers, heavily impacting men aged 45 and older. To totally ace the design phase of the exam, you need a beautifully structured matrix just like our proposed Living Longer and Healthier program. Notice how the objectives are broken into crisp categories: impact, learning, behavioral, environmental, and outcome. You can't just wave your hands and say, "We want people to be healthier." You've got to be specific. A learning objective could be, by year 1, 45% know what CHD is. A behavioral objective, 25% become more physically active. An environmental objective, banning smoking in public areas. And you must tie every single goal to an evaluation method, like knowledge, attitude, and practice, or CAPE assessments. Let's move to how this builds into a multi-level strategy. Public health doesn't happen in a vacuum, right? Your exam answer has to show interventions scaling across society. At the international level, you're localizing NGO funding. Nationally, you're engaging ministers for fast food and smoking taxation. Locally, you give out school grants for gyms. Down in the community, you start walking clubs, and all the way at the individual level, you provide one-on-one lifestyle coaching. This proves to your graders that you see the whole public health picture. All right, on to Section 4, Action Plan, Childhood Malnutrition.
Here's your next big prompt. You are the Provincial Nutrition Officer of Oriental Occidental. You have a 2-year goal to reduce the prevalence of malnutrition among children under 5, and it's backed by a promised provincial government budget. The exam asks you to create a plan of action, identify your stakeholders for both development and implementation, and design a rock-solid evaluation.
Your rationale here needs to be completely bulletproof. We're proposing the Nutrition for Life program. You must point out to your graders that targeting the first 1,000 days of life, literally from conception through age 2, is the global gold standard for reducing stunting, wasting, and mortality. By explicitly mentioning this 1,000-day window, you're showing them you understand current, evidence-based global health priorities.
Then you just lay out your actionable steps logically and chronologically. Step 1 starts before the child is even born, with monthly prenatal consultations. Step 2 hits at birth and onward, conducting monthly anthropometric measurements to strictly track growth. Step 3 provides tangible support through food vouchers for specific nutritional foods like milk and grains, alongside expert breastfeeding support. It's a highly practical, patient-facing flow. Now, the exam specifically asks who you'll involve in developing this plan. A complete exam answer requires interdisciplinary buy-in. You need the heavy hitters at the planning table: the Minister of Health, the Minister of Agriculture for food sourcing, NGO reps, community leaders to ensure cultural acceptance, and specialized medical professionals like OBGYNs and pediatricians to guarantee the science is totally sound.
So the crucial point here is contrasting those development folks with your implementation stakeholders. Who is actually doing the heavy lifting on the ground? Your answer needs to highlight the boots-on-the-ground professionals. We're talking volunteer data collectors, registered nurses, midwives, nutritionists, and breastfeeding consultants. These are the people executing the plan in the clinics and communities every single day. Finally, you've got to evaluate the whole thing. A perfect exam answer blends hard numbers with real human experiences. On the quantitative side, you're tracking facility data, aiming for a 5% reduction in malnutrition prevalence, but you absolutely must pair that with qualitative methods, KAP tool assessments, one-on-one interviews, and focus groups. This proves whether the knowledge, attitudes, and practices of the mothers have actually shifted, which is the true measure of a sustainable program.
And that brings us to Section 5, Conclusion and Next Steps. Okay, we've decoded the exam format, built a full precede-proceed model for heart disease, and structured a completely actionable nutrition program. Remember, this exam isn't designed to trick you. It merely tests what you already know how to do as a public health professional. It tests your ability to take a blank page, structure a coherent response, and apply evidence-based frameworks to save lives. So, I'll leave you with this final thought. As you step into that exam room, take a breath, look at the prompt, and ask yourself, how will you use these frameworks, not just to pass a test, but to solve the public health crises of tomorrow? You've got the tools, you've got the knowledge. Now go in there and show them exactly what kind of public health leader you are about to become. You've got this.